Hello and welcome. My name is Asaf Bitton. I am the Executive Director of Ariadne Labs, a Center for Health System Innovation based at the Harvard T.H. School of Public Health and Brigham and Women's Hospital, where I'm also a practicing primary care physician at a community clinic in Jamaica Plain. Joining me for this important conversation today on kids and health equity is Dr. Kevin Churchwell, the CEO of Boston Children's Hospital, and also the Robert and Dana Smith Associate Professor of Anesthesia at Harvard Medical School. Dr. Churchwell, it's a pleasure to welcome you to our program today. Thanks so much. You took over as CEO of Boston Children's Hospital in April of 2020, which seems both so long ago in some ways and not very long ago in others, certainly a month into the COVID-19 pandemic. Can you tell us a little bit about how your experiences previously in leadership and your career and life trajectory prepared you for this incredible array of new challenges? What's your leadership style and what's your philosophy and approach to leadership at a time of so much challenge and so much complexity?
Well, that's a great question. Hopefully, I won't take the entire 30 minutes to do that question. But I think that's an important question. I've had the opportunity to have experiences that I think have really helped me in this regard. I actually arrived, the first time I arrived in Boston was back in 1979. I came here to go to undergrad at MIT. And so I've had that relationship with Boston since that time, back and forth. I spent some time there, then I left to go to medical school and away, and then came back for my residency at Boston Children's, and then spent the next 8 years there during my time, and then a fellowship in pediatric critical care, which I think is pretty important in terms of my experience, and then on staff. I then left and spent really 15 years away, 15 to close to 20 years away actually, and 15 years at Vanderbilt in terms of their children's hospital. And actually during that time, I went from a practicing physician in pediatric critical care to administration. And so by the time I finished my time there, I was actually CEO of the Children's Hospital there. And so spent 3 years in that experience. And then subsequently went and became part of another pediatric healthcare system. And as a CEO of a hospital, a children's hospital in Delaware, the Alfred I. DuPont Hospital for Children. And then I was asked to come back here in 2013 to take the role on as Executive Vice President for Health Affairs and Chief Operating Officer at Boston Children's. And so I didn't walk into this job as President CEO de novo. I actually had experience and a time to really accommodate and be part of the work that happens here at Boston Children's. I actually started this position in April of 21. But of course, the pandemic, we were deep in the pandemic, and as you identified, April of 2020, and I was part of the development and the planning and execution and decision-making during that time. So all of those experiences, I think, have really helped me in thinking through how to deal with the issues that I'm confronted with in many respects each day. I think that my training actually in pediatric critical care also helped me to deal with issues that are abrupt or critical in nature, helping to work and develop teams, and helping to really decide what to focus on and how well to focus myself, but also those that work with me, those around me, on the issues at hand. All of those, I think, have helped me in terms of developing what you would call my leadership style. I believe that my style is directly related to being a servant leader, someone who is engaged in helping others achieve their best in their professional lives. And you do that by listening, active listening. And I work on that a lot. I'm not the best at that. And so that's a challenge, but one that I think is really important to really continue to be that active listener to others, and to try to understand what they're experiencing and how I can help them in their personal work, but also help them realize and appreciate what we are trying to achieve and what their role is. And so that's what, the work is every day, and it's what I try to sort of lead and move forward.
I appreciate that, and appreciate the comments on servant leadership and the importance of active and engaged listening. When you run an institution the size and scope and complexity of Children's Hospital, how do you manage to integrate the necessity of that active listening and support, and then move it to the necessary decision making, in which there's going to be, for any given issue, some really strong points on the one hand, on the other hand, on the third hand, and how do you take that perspective as a servant leader and then move it to action without being frozen almost by the variety of very legitimate perspectives on any given issue?
Right, and so it's a balance, right? It's a balance of that active listening and taking in all those important points, all those different viewpoints, and allowing that to be part of the decision making. But then being able to sort of put the period at the end of the sentence, to be able to bring the teams together, the groups together, the individuals together, and have them understand, okay, we've had the conversation and here are the viewpoints and here's where we're headed. Understanding that you're trying to sort of coalesce all those different ideas in terms of a plan of action. I don't get it right every time, as you can imagine. So there's a lot of practice that is undergoing in terms of that piece of work. But the more I do it, the more that I think I'm getting better at it. And I also try to do it intentionally. I tell the groups and individuals I work with, here's what I'm trying to do. Here's why you don't hear me say anything in the middle of our discussion. I'm actually paying attention. That's the one thing I have to tell them. I am paying attention, but I'm actively listening to try to help move the conversation along. That's been helpful to others to sort of, because I get asked the question, well, what are you thinking? Because you're not saying anything. And so I've had to talk about that also.
Yeah, sometimes that means that you're listening the best when you're actually not thinking just about the next thing that you're saying. Right. I really appreciate that. Well, you're at the helm of a really important institution at a really important moment of nationwide discussion and reckoning around racial equity and around structural racism. And in one of your first major moves, you've led the establishment of the Sandra L. Fenwick Institute in Pediatric Health Equity. I wondered if you could tell us why this new initiative at Children's matters, why now, and what it means to you and the entire field.
Well, what we've experienced the last 24 months has been an incredibly life-changing experience, I think, for all of us. Part of that life-changing experience is what our society has experienced. Certainly with the death of George Floyd and Breonna Taylor, it brought to the forefront the issues that have always been there, always been part of what we've had to deal with, but if in some respects were put on the back burner, not really truly addressed, and the issues around equity, diversity, inclusivity. And bringing that to the forefront along with COVID was an important part of how we at Children's decided that how we needed to address those issues, that it needed to be brought to the forefront, that we needed to really become intentional in our work around those issues, around equity, diversity, inclusivity. So part of that was the internal piece of work, internal to Boston Children's around developing the goals around that across our enterprise. We call them enterprise goals, and bringing those to the forefront and having active discussions around what are going to be our goals and how we're going to monitor, address them, and move them forward. Also importantly, it was recognized by Sandy Fenwick, my CEO, who stepped down last year. The importance of not just looking internally, but externally. and that we at Boston Children's Hospital are a leader in pediatrics. That is one of the issues that we continue to recognize on what we do every day in terms of leader in clinical care, education, and research. And in being a leader, we have to understand that what we do matters. What we intentionally work on matters. And so if we intentionally work on equity, diversity, inclusivity, then the rest of pediatrics will also recognize that and will be part of that. And so the external view of creating an environment for that was what the Institute is all about. Identifying that we are working on these issues internally, but our work is also external to us. And how do we lead that? So the creation of the Sandy L. Fenwick Institute around equity and diversity and inclusivity is something that we intentionally created for that reason. We haven't gotten it all solved. I will tell you that. We've kicked it off last October, but we're extremely excited about the opportunity and the work that we're going to push forward from that standpoint.
I appreciate that. I understand that there are three major aims of the Institute around eliminating child health disparity, diversifying the ranks of caregivers, and as you were talking about just now, also building and acting as a national model. And those are big and ambitious aims. Where do you think you're going to, or where do you know you're starting in terms of those areas? And then what might the next 3 to 5 years look like?
Right. So we expect not to solve all those problems in 1 year.
I'm shocked.
Right. So we'll take a little more time. We started with the infrastructure first.
Okay.
Right? How do we actually create an infrastructure for success? And that's with the people. How do we identify and help support and recruit those individuals that have an interest in the work, that are committed to the work? And so we're doing that even as we speak. We've identified our director, who is our chief health equity and inclusion officer, Dr. Valerie Ward, and have given her resources through support from our board of trustees and donors and the hospital to start the recruitment and the development of that infrastructure around leadership in health policy, infrastructure around leadership in the next evolution of health equity research, infrastructure around the development of the next generation of workforce that is diverse and inclusive. And so a lot of that is internal because we've had a great deal of enthusiasm by our physicians, by our administrators around this work. So that's been kind of the easy part, right? To develop those, to find those individuals that were just chafing at the bit to be part of this piece of work. And the next step is to, with that infrastructure, identify the first steps, the first initiatives that we want to focus on that will move the ball forward across that in the work that we're doing. Also important is the work around education in this regard, education around equity and diversity. And so that's where we are now, right? Taking those next steps in terms of identifying the grants opportunities for leaders, for individuals that are interested, identifying those programs that we're going to focus on, and the recruitments that we're going to focus on. One example is very early on is the opportunity that we worked and developed with the medical school, the Harvard Medical School, around the opportunity to recruit and invest in a diverse research opportunity, individuals in research. And working with the medical school, I think we've been very successful in one, identifying individuals and then working to recruit them to Boston Children's in conjunction with the medical school. That's just one example that when you become intentional, when you put your pedal to the metal, we can make a big difference quickly by being that intentional and that dedicated to the work.
I think that intentionality and that explicit intentionality is so critical. And my next question really builds on that. You know, this has been, as you said, these past 24 months is so incredibly hard, important, and clarifying about things that were already existing that need to be changed and need to be done. As you build your intentional strategy and structures around the ways in which the health system and your strategy will address and improve pediatric health equity, how do we, and this is both thinking at the level of Boston Children's Hospital, but also across the academic healthcare infrastructure, as well as all of healthcare, how do we ensure that equity, diversity, and inclusion stay on top of people's minds, agendas, strategies? They aren't the thing that we quote unquote did from 2020 to 2023 and then we're quote done. How does this become sort of intentionally integrated, top of mind for as long as it takes, not just a couple of years?
Well, that is really an important question. Those that work with me have heard me say this before, that my goal is to make sure that this conversation is not just a one and done. It's not something that we talk about for 6 months and then we start talking about the next important issue that rises to the table. That 3 years from now, we're still talking about this and planning and working on it with the intensity that we currently have in this piece of work. So how do we do that? My view is that we need to embed it in the work that we do. It needs to be part of the continued conversation. You know, the work that previously, the work around equity, diversity was always part of the conversation. Mm-hmm. But if you had created an agenda for a meeting, it was always number 10 on the agenda.
Right.
And so we always spent the last 30 seconds on it, as opposed to it needs to be number 1 or number 2 or number 3 on the agenda.
Right.
So that every time we have the time to spend and the effort that it needs to be spent on, to make sure that we are continuing moving that ball forward. And that's one part. The other part is that making it part of our goals, making it not just the yearly goal, but the next 3 to 5 years goals, to identify, okay, 5 years from now, where do we want to be? And making it so that we are monitoring it as we monitor our growth goals or our safety and quality goals on a consistent basis. So that discussion never wanes from those that are taking part in it, that are interested in it, that are helping us move it forward. Then also that it's at every level, not just at the level of the residents and their work, or the clinicians or the administrators, but so at the level of the senior administrators. It's at the level of the board of trustees. And so we currently have a quarterly plan of presenting to the board of trustees. Here's where we are with our equity, diversity, inclusivity work, and reporting out that is an active and engaged discussion, because now the board has the expectation that this is part of what we're doing, and we've put our goals in front of them. And are we achieving our goals? Why aren't we achieving them? What help do they need to provide for us to get there? And so all of that, I believe, is the work to keep it in front of us and help us to continue to make it top of mind in the work that we're doing.
I appreciate that you brought up, for instance, patient safety. That's where my mind went a little bit. 20, 25 years ago, bringing a patient safety lens to every conversation around every strategic and quality measurement move. And then 10, 15 years ago, it was patient experience. I think that part of this, what I hear you saying, is that you integrate this at issue point 1, 2, 3, as opposed to 7, 8, 9 on every big strategic agenda. But even more than measurement, it sounds like it's going to take that steadfastness of commitment at all levels, to just not make this, we dealt with that, or we had a safety initiative 15 years ago and an experience initiative 10 years ago and an equity initiative 5 years ago. It's never ending. It's a never ending journey. And that journey seems to also require help and change at the policy level, both at the state and local, state and federal level. Do you have thoughts on the sort of key next steps, moves from a pediatric health equity perspectives that could really turbocharge the steadfastness of commitment to this topic?
Well, our thoughts are really around first bringing expertise to the table around this work, right? Finding those individuals and asking them to help us educate us about the opportunities around health policy, public policy, and health equity and diversity in pediatrics specifically. And so that's part of what the Institute is doing, really creating that environment where we're have those individuals come to us, be part of us, educate us on the work, and then use our arms, use the work that we do every day in government relations, in our community work, to bring that to bear and our leadership in that. Identifying at the local level, regional, national, and national level. And I think that in doing that, we will make a difference. We are early in that journey, but I think the way we've described the work is going to sort of keep us in good stead moving forward in making real change.
You know, a related topic to that has both a clinical, a system, and a policy lens, and of course with the pandemic, some of the most heartbreaking and difficult parts of the pandemic have been in seeing the sharp rise in behavioral health and mental health challenges, especially in children and adolescents. You know, I'm an adult primary care doctor, and I spend a lot of time with my patients trying to help them figure out for their kids, where are they going to get resources and integration and connection for their behavioral health challenges, which have only grown through the pandemic. What are you seeing at Boston Children's Hospital, in the ER, in your clinics? I know it's been hard, but I think we need to talk about it, and then talk about I'd love to hear your perspectives on how we address this. It's a system challenge, but a societal issue.
I'm so thankful that you brought these points up. You know, as we've gone through these last 24 months in pediatrics, certainly we've seen patients with COVID, kids with COVID, who have needed our care in the hospital. It hasn't been a significant number, and we're extremely thankful for that. But what we have seen and what we have described as our epidemic, our pandemic, is the pandemic around pediatric behavioral health and the mental health challenges. We were seeing this before COVID. We were seeing a rise in the number of our children with these issues presenting to our emergency departments, presenting to our primary care practices. But with COVID, it has become overwhelming. It is not idiosyncratic to the state of Massachusetts, it's nationwide. The issues why this is happening, it's still unclear, but it's certainly around anxiety that's been promoted and created by COVID, but anxiety around not attending school, but then the anxiety around going to school, anxiety around social media, and all of those have presented us with an issue that, in terms of its volume of the number of children it's affecting, is in many respects overwhelming. So it's created a laser focus on solutions. Now, certainly there's short-term solutions. I call them sort of the Band-Aid solutions of creating more space, creating more beds for the care of our kids with these issues. But it's also given us the opportunity to think through and begin to develop what are the long-term solutions. How do we actually create an environment that there is a continuum of care for our children with these types of issues? A continuum of care that starts with the family, that then helps support the primary care pediatrician, that helps support the school system that they're part of, and the community programs that have been doing this work for a significant period of time. And how do we do that? And so create an environment so they don't have to come to us. They don't have to come to the hospital, or they come to the hospital in significantly fewer numbers. I think that's the piece of work that is in front of us. We believe that we've started this work at Boston Children's by working with a fellow institution, Franciscan Children's Hospital, and that we are working to create a true alliance of sister institutions where we're going to create a campus that really concentrates on behavioral and mental health in our kids, both not just inpatient, but outpatient care, not just outpatient care, but community-based care that actually is involved with our school system. And then the development of the next education around this and the development of the next generation of caregivers that we need for our kids with these issues, whether they be psychologists, psychiatrists, social workers, nurses, nurse practitioners. And then the research associated with this. You know, the care that we provide has really changed dramatically for a significant period of time, and it's probably not addressing the need. And so the work that needs to happen to understand what's the next evolution of care is all about the research that needs to be put in place for that to happen. So we believe that that's also going to be part of the solution set as we move forward.
You know, that ties into my penultimate. I have two more questions for you as we watch the time, and I'm deeply appreciative of that answer around such a complex topic, which is a microcosm for, you know, pediatrics helps remind the rest of medicine and healthcare about the need to cultivate human health from an early age, the impact of positive and negative experiences early in life on the rest of human health, and the recognition that healthcare, of course, that health is, of course, not just created by healthcare, it's created way beyond the four walls. You know, beyond the four walls in Boston, you know, we have a situation in which, you know, at birth, the life expectancy differential between a child who's born in Back Bay and a child who's born in Roxbury is almost 30 years. And so as a leader of a preeminent children's health system, how do you think about framing that? How do you balance the need to address human health in its entirety from what you can do from your perspective and your resources and your talents?
I guess we've got another 30 minutes to talk about that,
Or
right?
30 hours.
But to start the discussion, you know, it's the classic, you've got to be able to walk and chew gum at the same time. We've got to be able to identify and work on the series of issues that you just laid out that are involved in child health. You know, child health is this broad issue. There's the child health that is around disease, chronic disease, diseases that don't have a cure, don't have a treatment, children with cancer, children with cardiovascular congenital disease, children with genetic issues. And Boston Children's is at the forefront of working on those, finding solutions for and treatments for diseases that don't have a solution or a treatment plan. But then there are also the kids in terms of child health that you just described. And how do we engage in their care? How do we engage to help them have the best life they possibly can? And that's involving, you know, the work around early childhood education, early childhood health. And how can we can't solve the problem as a hospital, but we certainly can be a convener. We certainly can be an institution that brings together all the interested parties, whether it's our colleagues in public health, whether it's our colleagues at the state or at the mayor's office, that really are focused on creating that environment that really supports our children and bringing them together to create solutions, to talk about what the issues are, and for us to then move those solutions forward. I believe that's part of the work that we can do at Boston Children's, to be that convener, to be that sort of nudge, to your point, that, you know, we're always that nudge. We'll be that nudge that says, you know, we haven't solved this problem. And we've had this great discussion, but next year, what are we going to do? 5 years, what are we doing? What's the strategic plan for this? And we're going to help you develop that. I believe that's what we should be doing, and that's a great opportunity for us.
Appreciate that. And, you know, my final question, you know, we've spent the last, 28, 29 minutes talking about a lot of really hard, complex challenges and problems. I wanted to pivot and hear from you. As you think about the future of children's healthcare, what are you excited about? You know, what's animating you? What do you think you want to let others know about that really makes you hopeful for the future?
Well, I'm hopeful because of the great people that are doing the work in our discipline, in pediatrics, in medicine in general, but certainly in pediatrics. The generation of physicians, nurses that are here, that are coming up, are incredibly innovative, incredibly excited about the work that they do, and are bringing to bear ideas and enthusiasm and their smarts that I think are going to change the world. We're at the cusp of a lot of great things. We're at the cusp because of the work that's happened before us in terms of the Human Genome Project, the work that's happening in gene therapy, in stem cell therapy, in work in the creation of new devices for the care of children that are going to really change how we practice over the next 10 years. It's going to be rapid, it's going to be exciting, it's going to be phenomenal from that standpoint. We're also at the cusp of identifying, what are the key issues and opportunities and programs and innovations for our children's health in general, broadly. Identifying, how do we actually promote and create an opportunity for every child to have the best life possible. We have the interest, we have people, we have the knowledge and the technology that's being developed to truly make a difference. I'm excited to be part of that. And Boston Children's is excited to be part of that. And I think that that's what our next 10 years plus will be all about as we move forward.
Well, I wanted to really thank you for really an incredible start of a discussion, an incredibly rich discussion in a short amount of time. This concludes our section, our segment now, but I'd love to pick it up with another few hours or more. And really to thank you, Dr. Churchwell, for such an engaging, informative discussion. And we're going to watch the progress of all of the endeavors at Children's, especially around the Fenwick Institution, with great anticipation and excitement, and would love to hear more soon about where this exciting vision is going. I want to thank as well all of our viewers for joining us. You can view the full discussion on the Harvard Chan YouTube channel. And again, I just wanted to thank you, Dr. Churchwell, personally, and in particular for your leadership during these tremendous times, and look forward to talking again soon.
Thank you. Thank you so much.